Hello, everyone, and thanks for your time, and thank you for the AAPM for offering this opportunity to help me explain about Cipra.ai. My name is Sumeet Maniar, and I'm one of the officers here. And what Cipra AI is a digital health solution that leverages various AI technologies to treat various chronic care conditions in the marketplace. And the problem situation is significant in the sense in the US, chronic care and chronic pain patients face a lot of issues with comorbidities, particularly hypertension and diabetes and other parameters. And Cipra.ai provides a very easy to use solution that does N of one learning of the patients and does personalized recommendations. And as a consequence, these personalized micro nudges, if you will, has drive patient adherence to compliance up to 90% 90 weeks out. And as a reduction of this, we've seen tremendous benefits in reduction in hypertension aspects, behavioral health aspects, and even glucose monitoring, three significant areas of huge chronic issues that impact a lot of patients. So from that perspective, Cipra was developed by a founder that I'd worked with before, Dr. Sujit Day, at the UC San Diego Connected Health Lab. And from there, other physicians and PhD students spent 5 years developing these models and training them on a combination of generative, semi-supervised, and explainable AI. And as a result of these impacts, for example, in the use case with hypertension, just within 5 weeks of time, the entire population health with respect to hypertension patients saw a 15-point reduction in their blood pressure scales. So, and from my personal experience, for example, it did an N of one learning of me, and these recommendations are such targeted and nuanced, it's very impactful. So I tried it, and then 7 to 10 days later, after it learns enough data about having your iPhone connected, and or wearing a certain type of device, a smart device, it made the suggestion that, Sweet, those nights that you go to sleep at 10:30 p.m., my blood pressure is about 11 points less the next day. So similarly, these guidances are put in place for other models and other modalities for patient care in terms of diabetes, and then also expanding to mental health. And as a consequence of these aspects, we've formulated our solution not only to health systems, but also even pain providers, and it's being launched as we speak there. Now, in particular, what we've seen is tremendous reduction in staff workload, down to about 90%. If you look at the standard of care, the amount of effort to treat and service the patient has been taken over by AI, by these personalized recommendations. And then we're also seeing better health outcomes, and then also improved engagement of the patients and patient-provider satisfaction, if you will. So a specific example is UCSD, where they leveraged this solution, and within a few months they realized for 200 patients, they realized a 1.4 million in savings, and then in particularly, they liked the solution so much that they went from a fee-for-service schedule entirely to a value-based care model. So where Cipra.ai is it's expanding in from a product capability, and then now it's ramping up for sales growth and additional volume. We're still considered seed or mid-seed stage, and we're looking for assistance and working with the AAPM. My past experiences, I was the co-founder of WellBrain, and we launched that successful as a pain management solution for non-opiate modalities, and also worked with neuromodulation companies to help providers get different types of pain solutions to their patients effectively. So thank you for your time, and I look forward to a successful discussion or presentation at the AAPM conference.